Good evening. Tonight we will see one thing. Yesterday, one incident happened. One of our student has expired. She is a third year GNM student. Very beautiful girl. We all left for, she is a day scholar. We left for our Durga Puja holiday. She had a fever, mild fever she had. Then she took paracetamol 1 day, 2 day, 3 day. Afterwards it is not stopped. Maybe and very late they have gone to the doctor. By the time maybe septicemia, doctors told brain is not responding. So this is the scenario. From that what we have to learn. First thing, what is fever? Fever is good or not? Fever is actually good. It is representing what is happening inside our body. Any infection which is present, that's reflected. That's the one symptom which you can see and you can treat it. Believe it or not, when 2021, when my parents were suffering from COVID, they were told there is no fever. They told no fever, they just give paracetamol, but they told the another symptom that 1 or 2 steps they were taking and keeping, there was a wheezing. Immediately I called the lab technician, I told them go and take the C-reactive protein, some of the blood tests. Simple CBC will be telling what kind of the fever they are having or any infection, the abnormal WBC increasing, C-reactive protein rate will be increasing. So correctly identified. By the time I reached, then the doctor told it is good you have identified, then you go for the MRI scan. Believe it or not, MRI scan 80% lungs has been collapsed for the 2 parents above 75-year-old. My mother, heart is swollen. Why I am telling is fever is a indication where there is normal layman know that the fever may cause something, maybe inside fever will be reflected. It is not, sometimes cancer, why you cannot identify, no fever coming, nothing coming. Okay, the fever is different kind of type of fevers will be there. For example, TB, if you take night sweat, night fever will be coming. Why fever is, you have to take it important. You see, small baby is suffering from fever. They were telling, the book is telling that below 5 years, high temperature will be epileptic attacks. Child will be go for the epileptic and lifetime they have to take the medication, eptoin. Febrile fever cause the convulsions. That's what we are learning. Then what about here, 21-year-old girl how dying with fever? Even in this crucial age, sometimes throat infection cause a fever. How it will happen? Throat infection is caused by simple streptococcus, staphylococcus organisms are causing. So usually we are telling adolescent girls are getting affected. But if your immune power is so less, again it will disappear within 7 days and then it will go to the bacteria. Then it is affect the various joints, arthritis. And it is also rheumatic arthritis and the heart also it will be rheumatic fever it is called. So what I am telling is, okay, you understand what is fever, increased body temperature. There are intermittent fever, kind of different types. But the simple layman, what you have to understand about fever. If your child less than 5 years having a fever, when I was breastfeeding my child, my baby in a 6 month, I felt that she is having high fever. Fever cannot felt in the outside, but then immediately there was raining outside. But still I have taken her and I poured water, normal ordinary water, not a cold water or the very hot water. And then I wrap up the baby and small baby medications, paracetamol is a good, but vomiting may come, so we can put it as a suppositories. So then fever reduced. So what I am telling is, good you are taking paracetamol, but what happens? What the mistake you are doing? Taking paracetamol 1 day to one doctor and another day to another doctor. 1 day doctor will give paracetamol, he will tell you to take for 2-3 days. It is not effective, you jump into the another doctor. And doctors in the chamber have 200 patients, they don't have time to listen your history. Did you went to the another doctor? So he again start with the another one paracetamol course. Right or not? So jumping off the doctor one and medications, self-medications. 1 day fever not stopping, 2 days okay, you are seeing viral fever, PCM not stopping. 3rd day, why can't you do some CBC? In that you will see that WBC any abnormalities are there. Then this is the season changing, dengue, malaria, silently. Dengue have a different kind of fever. Dengue hemorrhagic fever. Silently it will kill you. Dengue, the main symptoms, the platelets will be down. One student day before yesterday, this girl was in a coma. In our own Disari hospital, she was admitted 3 days. We were like so much depressed. One girl came to me, madam, my platelet count is reducing, only this much amount is there, 40,000 something is there. But did you diagnose? go for any test, confirmative test. No, madam, there is no diagnosed as a dengue. Okay, don't believe in one laboratory. Believe one doctor, I am just telling, but another confirmative test, you do it again. Or why platelets, go and admit yourself. And platelets, whenever reducing, it is effective. Even 65-year-old man, when the platelet dengue he was diagnosed, the treatment, simple treatment I have given them is papaya leaves. Wash the papaya leaves and cut into small pieces, put in a mixie, add a little half glass of water and milk the juice, and take the juice and give them to you. Immediately the count. Studies may be proven. Now we have a papaya syrup for the children, they won't drink it. So your manual preparation, no problem. You go to the medical shop and rather taking self-medication, this one will be helping, but better if there is increase, please, if the doctor is not listening history also, doctor already I am having, or you are a nursing student, why nursing student has to die, you are a medical professionals, why can't you taking self-medication, why can't you self-examine yourself, why can't you go for the laboratory and do the test again, examine yourself. See one thing girls, you are the medical professionals, if you are mentally and physically strong only, you can give that positive energy to your patients. This is very pathetic because it's a heartbroken one, because she has already engaged 6 months before, her marriage is about to 3-4 months, and only next 2 months December she is going to appear for final exam. See, 21 years. So what I am telling is, we have to learn a lesson. Self-medication taking another thing. Fever is a good, the symptoms, what is happening inside our body. If a throat pain, at least you might have started with the antibiotic. Okay, self-medication you are taking, at least you might have taken, if it is a throat pain, some tablets, you can take it as antibiotics. No antibiotics has been started. So how the meningitis will go? How meningitis will be? First it will enter into the body through the throat only, 80% through the throat. And if you are not treated, it will bacteria enter into the blood, the poison, bacterial poison. Or then these bacteria or sometimes enter directly into the meninges of the brain. Meninges is nothing but the coverings of the brain, and it is, brain is inactive. No treatment. After end of the day, all vancomycin, pantacid, all avifluids, nothing is effective. Pupil is sluggish, Glasgow Coma scale is only 3. So prevention is always better than cure. One day you see, 2 days you see. Better you go for the just CBC, then you go to the doctor. Don't take any self-medication. Okay, you are taking paracetamol, no harm in it. Take every 4th hourly, but admit yourself. Even the doctor is not asking your history forcefully. You make him to listen the history and tell him, doctor already. If you have taken the blood test and go to the doctor, doctors will be very alert. Okay, she knows something very serious, we have to treat her properly. So this is an awareness. So take care. Prevention is always better. Your health is best. The first person you have to take care of is ourselves. Ourselves. Education is for our betterment, but health is the first priority. So prevention is always better than cure. Take care of yourself. Just I created for the awareness. Thank you.